Can cystoscopy reveal hidden bladder problems? Imagine being able to look inside your bladder without surgery. That's what a cystoscopy allows. It uses a thin, lighted tube called a cystoscope to give doctors a direct view of the bladder and urethra. This procedure is considered the most reliable way to find many bladder issues, especially bladder cancer. It helps doctors see abnormalities like tumors, inflammation, stones, or structural problems that might not show up on other tests. Because of its accuracy, cystoscopy is often the first step in diagnosing bladder conditions. During a cystoscopy, the doctor inserts the cystoscope through the urethra into the bladder. They can then examine the lining for any irregularities. If they see suspicious areas, they can take small tissue samples called biopsies for lab analysis. This is especially important for detecting bladder cancer early. Cystoscopy is also used to monitor patients who have already been treated for bladder issues, helping catch any recurrence quickly. However, even though cystoscopy is very useful, it has some limitations. Standard white light cystoscopy, which uses normal lighting, can sometimes miss small or flat lesions. For example, carcinoma in situ is a high-grade, flat bladder cancer that can be difficult to see with regular cystoscopy. Studies show that cystoscopy detects about 81% of true positives but can miss around 19% of bladder tumors. In some cases, patients initially told they had no cancer are later diagnosed with tumors that were overlooked during the initial exam. To improve detection, doctors now use enhanced techniques like blue light cystoscopy. This method involves applying special dyes that fluoresce under blue light, making flat or subtle tumors more visible. Combining cystoscopy with other tests like urine cytology, which examines urine cells for cancer, or imaging scans such as ultrasound, CORT, or MRI, further increases the chances of catching hidden problems. These combined approaches help ensure that even the most subtle or concealed bladder issues are identified. In summary, cystoscopy is a powerful tool that can reveal many hidden bladder problems, especially visible tumors and structural abnormalities. But it is not perfect and can sometimes miss small or flat lesions. Using advanced imaging techniques and additional tests alongside cystoscopy helps provide a more complete picture of bladder health. Always remember, if you have symptoms or concerns, consulting a healthcare professional is essential for personalized diagnosis and care.